Hello, my name is Mark Whitaker. I'm the Associate Program Director at Resource Connect, and we are an outpatient substance abuse program here in Towson, Maryland. And I'm going to be talking to you a little bit today about drinking during the pandemic, how to identify if you might have a problem, and then what are some resources if you decide that you need some support. And in thinking about how to start this conversation, I decided to go online and just research, well, how has drinking changed since the pandemic hit? And while I think that there's some incomplete data out there, the general trends do seem to look like drinking has increased. Alcohol sales have definitely been up, which could be a sign that drinking has increased. Although it could also mean that, with all the bars and restaurants that have closed, that people are actually drinking comparable amounts as they were before. They're just doing so at home instead of out at restaurants and bars. But aside from alcohol sales, there definitely have been some studies that have shown that people's self-reported rates of drinking have been increasing, both in terms of the frequency that they're drinking and the amount of drinks in any given setting that they're having. So it does seem like drinking has increased, and if you feel like that's somebody that you fall in that category and you're concerned about your drinking, the first thing that comes to mind is that it's completely understandable. I think it makes a lot of sense, and really for two main reasons. The first is just stress. I think that the pandemic has produced a whole new set of stressors across all facets of our lives, occupationally, personally, family relationships, friends, physical health, mental health, just really across the board. It's just incredibly stressful, which I suppose is obvious. But then also a lot of the activities and coping skills that we normally use to kind of balance our lifestyle have been totally taken off the table for us. There's definitely been a constraining kind of effect for the things that we normally do to stay sane and healthy. And so those two things alone, I think, increased stress and limited ways of coping with it. I think it makes a lot of sense why drinking would increase, especially if you're somebody who's ever drank as a form of stress reduction. And so even though it might be understandable that drinking has gotten worse, it's still something to pay attention to, because especially if drinking becomes your kind of default coping skill that you're using to manage and treat all of these stressors, that can definitely become a problem, which then raises the question, well, then how do you know if you have a problem? One thing I want to mention is that it's kind of commonly thought out there that you might be a heavy drinker, but as long as you're keeping up with your work responsibilities and your relationships seem fine, that you probably don't have a problem. And that's something that we often kind of push back against a little bit, because as clinicians, when we're looking at criteria to diagnose somebody with a substance abuse disorder, we look at a lot more other variables to paint a fuller picture. And so we're looking at other things also, like how much time are you spending drinking, thinking about drinking, and trying to acquire drinks. Have you developed a tolerance, and do you need to drink more to get the same effect? Have you tried stopping drinking and done so unsuccessfully? Have you ever stopped and maybe developed withdrawal symptoms? Do you find yourself craving drinking, and how intense are those cravings? So there's a lot of other factors that we look at that could determine whether or not there's a problem that needs to be addressed, and it's not just a matter of having avoided a DUI or showing up late for work. And so as far as resources that are available to you, there's a couple things to consider. One would be to just talk to somebody, a friend, spouse, partner, parent, anybody in your inner circle that you're comfortable with. Talk to them about it, whether you're convinced that you have a problem or if you're just concerned that you might. It can be hard, it can be a little awkward and uncomfortable talking about it, but not only is it very psychologically healthy to share about this and to relieve yourself of the burden of going through this alone, but in the event that there are steps that need to be taken for support, it ensures that you have people in your corner to do that with you. Outside of that, there are a lot of different great support groups out there. So there are things like Alcoholics Anonymous, Narcotics Anonymous for people who are struggling with other substances outside of alcohol. There's a group called Smart Recovery, which addresses all forms of addiction and not just substance-related ones. And each of these groups have closed and open versions of them. What that means is a closed group you have to be invited to in order to attend, whereas an open group, anybody can just drop by anonymously to connect with other people who are going through something similar. And they're just great opportunities to learn more about recovery, learn about some pitfalls that people have experienced so that you might be able to avoid some of them yourself. And all of those AA, NA, and SMART all have websites that you can Google and look for open meetings that are in your area, based on zip code. So I encourage you to do that. And then beyond that, there's also more formal treatment options. So this could be something like a supervised detox, or a residential rehab center, or a program like ours, like an outpatient program, which is a place where you would come and do group therapy a few times a week. Although most of what we're doing now is being done virtually, we still offer that service. To other things like individual therapy or medication management, and whether that's to manage cravings or other psychiatric things that might be going on. So there's a lot of different options out there, and in the world of treatment, it can be a little overwhelming, and so one of the best ways to clarify what the best route would be for you would be to give us a call. We're always happy to answer questions, excuse me, or to schedule an evaluation, and we can get you in here and really do a full assessment and look at all those substance abuse criteria that I mentioned before, as well as other aspects of your background, to kind of figure out what recommendations are going to best suit you. Because it's not a one-size-fits-all approach. It might just be some individual therapeutic support would be the ticket, but it could be in combination with an IOP group or something like that. So we are always open to answer questions. You can feel free to contact us by email or call, and myself and everyone else on staff is always happy to answer questions and get you the help you need. So I hope that was useful, and I guess we can open it up to questions if anyone has any.
I do have one right now. How do I decide I need IOP as opposed to inpatient or just AA meetings?
Good question. That, again, to fully answer that, I think an evaluation would be the best way, but IOP is for people who are struggling with substance abuse, but it's not to the point, like if you are at a point where if you're going through active withdrawal, and you're getting shakes and sweats and stopping drinking becomes a real problem physiologically, that might be a situation that calls for an inpatient stay. Anybody can go to AA meetings, regardless of how severe your drinking is. I mean, they're just really supportive communities for people at all stages. So even if you're just curious, you can go to an AA meeting or any of the others.
How big are the groups, and what do you talk about in them? That's connecting with the last question.
Sure. So our IOP groups, I would say they average around 8 or 10 right now. It kind of fluctuates depending on the time of year and just what's going on, but it's about 8 to 10. And we talk about all kinds of things. The first part of group is usually kind of an open check-in where people can share any updates or relevant things that are going on. And then there's usually some sort of didactic or educational piece, and we might be talking about social skills or relapse prevention, triggers, coping skills, family dynamics. I mean, there's a whole curriculum that we follow that addresses a lot of different aspects that are all related to recovery.
Other than group therapy, what are other components of the program?
So in addition to group therapy, so each person who's a client in the program also gets assigned a case manager, and that's somebody that they can meet with on a weekly basis, and they set a treatment plan with that person, and each week when they meet, they kind of touch base to see how well they're doing accomplishing the goals that they've set for the treatment plan. But case management can also be used as kind of like a therapeutic support as well, especially if somebody's kind of waiting to get set up with an individual therapist. So case management's a part of it. Individual therapy can be a part of it, and also medication management can be a part of it, and then also some of the outside support groups that we mentioned earlier.
And how can you support a loved one who is dealing with substance abuse?
Great question. It can be really hard to do that. I think one of the best ways to support a loved one is to remember to invite them in to share their experience instead of just kind of kicking down the door and hurling accusations and ultimatums at them. People tend to not respond well if they feel like they're just a problem that needs to be solved. And so remembering to invite them in, create a space to really listen and just bear witness to what they're going through, and then asking them what would help them instead of just presuming, really asking them, how can you be of service? Do they want you to accompany them to the meeting or to maybe an evaluation here? Or do they want some help making phone calls? Things like that. So there's a lot of different ways that you can support them, but I think regardless of which way you do it, the most important thing is to try to do it from a place of love and support and not judgment and accusation.
And what benefits do you see from doing group therapy as opposed to individuals for someone struggling with a substance use disorder?
Sure. Group therapy can be great because, well, they're both great. Individual is great because it's nice to have a dedicated place to process whatever you're going through. But group therapy in particular is really nice because you get to connect with other people who are going through something that's similar, and you learn a lot from other people's experiences, whether they have the same drug choice or not. You learn about what worked for them, what didn't, what problems they ran into, how they overcame them. And so it's great for that. It's great to have that camaraderie. It's also great because it's very structured, especially if you're somebody who's out of work or has a lot of time on their hands. That's one of the things that's been really tough in the pandemic, is all this time that people have, and it's very unstructured. Group therapy is a nice way to provide some routine and regularity in addition to having a lot of that bonding and connecting. And then also the thing that's good about group therapy is for anyone who struggles in social settings or with social anxiety, which can often lead to substance use, it's a great place to practice building some of those skills and learning how to be resilient in uncomfortable social situations.
What is a healthy way to cope with stress during this time?
Oh, well, there's a lot. I think that it's very individualized, but I would say try to get outside as much as you can. I know that's tricky now that it's getting colder, but physical movement helps. Getting good sleep is crucial. Trying to maintain a healthy diet. Maintaining social connections, even if it's not ideal. I know that people are kind of zoomed out, things like that, but making the effort to have phone calls, Zoom calls with people, staying connected is important. Finding the things that really help restore you. I know a lot of us can enjoy binge watching shows, and that sometimes that's just what the doctor calls for, but it's also good to keep in mind when you're choosing how to spend your time, not just choosing what you're in the mood for, but what you're going to feel better after you've done it. And so sometimes what you do might be different depending on the answer there. And so whether it's like taking a hot bath as opposed to scrolling on social media, for example. But yeah, you really got to find what works best for you.
How can you encourage someone during the holidays about drinking without telling?
How to drink without telling? So I'm not quite sure I understand the question. Is it?
I think they're asking, how do you tell someone that maybe they're drinking too much without actually saying, hey, you're drinking too much?
Oh, okay. I misread that. I never understood that. I thought it was, how do you get away with drinking?
Drinking too much?
Yeah. That's tough. I think that there's more of an art than a science there. It depends on the person. It depends on you and what the relationship is like. But I would kind of bring it back to what I mentioned earlier about supporting people in general, which is it's okay to ask somebody how they're doing, and to let them know that you're a little concerned. Sharing that you're concerned and asking somebody to check in, how have you been doing, is a very generous thing to do. And even if it's uncomfortable to do it, I think most people will respond well, as long as they don't feel like it's just an invitation for them to get lectured by you. And so if you are mindful of your tone of voice and your body language, and you do it in a way that's genuinely open, as opposed to judging, I think that's the best way to address it.